is Carol. Welcome to our yoga and psychiatry. I'll be presenting 3 of the questions that were asked in the assignment. The first one is concerning a 50-year-old veteran with PTSD. During my class, he had let me know that he does have PTSD. This was extremely insightful for my class to ensure that I was sensitive and just knowing a little bit more about him. One of the things that I would do for him is I would invite him to a pose that he can or cannot do, but making that an opening for him. And I would also tell him that it would be really important for him to focus his mind during the practice on the breathing as well as the meditation. Also, during the meditation, it may be helpful for him to think of a word, a positive word, and concentrate on that word to have him focus, as well as some of the other poses, also to let him know that breathing is really important, not to hold his breath. Those are some of the items I would tell him prior to the class starting. Our next scenario is regarding a bipolar student. I'll be going over the yoga pose. I recommend a pranayama, breath, as well as meditation. Let's cover the pose first. The first pose that I would recommend to the student is seated forward fold. I'll show you what that looks like. The student is in staff pose with the feet flexed up. Arms could be at the side to get settled. And I would instruct the student to inhale up with their arms and exhale, bring the body forward toward the feet, grasp on to what is available. It could be the calf, the ankle, outside of the foot, toes, and to stretch here and gently bring our head forward towards our knees as we inhale and exhale. A couple more breaths here as we stay here. The pose itself, the benefit of this pose, it also helps release stress. Oftentimes there may be anger. This helps to soothe, as well as to stretch out our hamstring, our calf muscles, as well as our lower back. And we inhale to rise up. That would be one of the poses I would recommend towards her. Other ones that I'm not going to show would be baby cobra pose, as well as eagle, a great concentration one. Those would be other 2 poses that may benefit the student. The other thing for pranayama breathing, I would recommend alternate nostril breathing, and how that breathing takes place is you use your thumb and your index finger. The thumb is pressed on the right nostril. We'll start with the right, and as you inhale, the thumb is pressed in, and then exhale at the opposite nostril. You release the air, and the index finger is pressed on that nostril. So it would go inhale with the thumb and exhale with the index finger. We would do the breathing for at least 5 times. This also helps with the breathing as well as focusing and relaxing. The last one from meditation would be to see what is comfortable for the student. Either seated or could be lying down with a bolster perhaps underneath the legs in our Shavasana. That could be part of meditation, but either way, in the meditation pose, I would invite the student to practice just breathing in and out, focusing on perhaps a word or a sentence, and concentrating on what our body is telling us, and to do our best to quiet the mind. And if our mind starts to get busy, I would direct them to focus on one thing, perhaps a word. I am beautiful, I am courageous, something to that effect. Those are the three items: the yoga pose, the pranayama, and meditation for the bipolar person. The third question was concerning having a private yoga lesson with a student who has PTSD, and what would I do for them. I would first ensure that they're comfortable, perhaps getting a little bit more history about them, not anything diagnostic, but just a little additional information. Also, I would incorporate considerable deep breathing through the nostril, also having them place their hand on their stomach and on their heart, and concentrate on the deep breath in, and then exhaling out, feeling the stomach towards the spine, and as they inhale, the stomach extends, and as they exhale, the stomach retracts in. Seeing just how that is relaxing their body. Also, I would incorporate slow movement for them, nothing fast. Not sure what their triggers may or may not be, but slow, gentle poses, honoring where they're at, as well as reinforcing remaining calm as they do the poses, to continue to breathe so they're relaxed. As well, lastly, I would recommend, if a pose may be challenging for them, is to skip the pose and we would do a different pose, just so they feel good, as well as calm and feeling just great about what they're doing at the moment. Those are the answers to the three questions regarding the 50-year-old person with the PTSD, the bipolar, and then the private practice student with the PTSD. I hope you enjoyed this video. Have an awesome evening. Namaste. Thank you.